If you're on Medicare Part D, you need to understand what prior authorization is. Hopefully, you never have to deal with it, the hassle of it, but if you do, this video is going to help you understand what you need to know to get through it as smooth as possible. Stay tuned. If you haven't watched The Tiger King on Netflix, I highly recommend you do. If you do, you'll understand why I'm dressed like Carol Baskin and why I have this tiger in my video, because I was super bored during quarantine where I'm trying to make these videos for you. I hope you're happily and comfortably on your couch so you can listen to this rather dry topic about prior authorization. If you pull out the formulary with your Medicare Advantage Part D book, it lists all the drugs that are covered. It tells you their pricing tiers, tier 1, 2, tier 2, 3, their brand name or their generic. You look at that. Behind some of the drugs, it'll say, yeah, we cover it. We cover it, but it might have a ST, which means step therapy. It might have a PA, which means prior authorization. It might have a QL, which means quantity limit. So I'm going to talk about PA, prior authorization, which is pretty easy. It means that you can't just go get it. Pharmacy has to call to get permission that they can give you that drug. It's just an extra level. And what a lot of times is that the pharmacy tech says that your insurance rejected this drug. Do you want this generic? And so you go, okay. The truth is, the pharmacy techs are very busy and historically underpaid, overworked, and unsatisfied with their jobs. And I've known several people that have been pharmacy techs and they hate it. So I wasn't shocked to learn that they kind of fudge a little bit. And that when they're telling a client, sorry, your insurance company doesn't authorize this. A lot of times that's a fudge, a lie, because they never called. Or maybe they called but they couldn't get through and they weren't persistent. So they just said, hey, blah, 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 blah. Do you want this one? And you're oblivious, so you say yes. So the way you protect yourself from the apathy of the person that's making minimum wage there, your doctor wants you on that drug. That's why she wrote the prescription for that drug. Ask the pharmacy tech when they tell you that it's not authorized for the rejection form. Okay? That's your legal proof that it's not authorized. If you ask for that form, highly likely you're not going to get that form because they never actually were able to connect with your doctor to get that prior authorization. Not the doctor. So that's just a little insider secret. You get so frustrated because a lot of times when you're at the pharmacy, you're already sick. And in this day and age, now you don't want to be in the pharmacy at all because you're nervous about the germs, the other people that are in there. So the more you understand how your Part D works, when you open up that formulary and you see, is your drug covered, what tier it is, and what those little initials mean after it, the better informed you are before you even get into the pharmacy, or if you're dealing with them online or over the phone, it'll just lower your stress level, because dealing with your medications is highly stressful. I was dealing with my daughter's Advair inhaler today on the phone, and it was all I could do not to just hang up. And that, it was just a very simple thing, but it's a very, very frustrating process. And the older you are, the sicker you are, the more apathy of the tech. You're probably going, yeah, I know what you're feeling. So rely on an agent. Find an agent. If you don't have an agent, if your agent's retired, died, gone AWOL, you've worked just with, you just called the carrier and you don't really have a personal relationship, we can recommend a live agent in your area. You can work with the Medicare Family. We'll be happy to answer your questions. You can put them in the comments. You can email us. You can call us. Working with us is always free. You don't pay extra to have an agent, but the agent is there to advocate for you, to help cut all this red tape. Because as you go forward, Medicare is your health insurance for the rest of your life. As you go forward, it's not going to get simpler. I don't want to say you're not going to get smarter, because hopefully you do want to get smarter, but it's a lot of work to keep up with it. So chances are you're not going to get smarter. You're going to be like, I thought I knew it. But if you're not really staying up with the constant changes every year, it's just going to seep away from you. Let your agent stay up with it. Let your agent keep you up to date. Get an agent. Get somebody on your team. Thank you for watching. If there's things that you specifically are confused about Medicare that you would like to have a video on, share with the rest of the consumers out there. Tell me in the comments, I'd be happy to make them. Thanks.